Okay, if you've been to the emergency room lately, you know you are far from alone. Talk about long lines. And a new report suggests one reason is that more Hoosiers are losing their health insurance. Okay, so here's what's happening. Our partners at the Indiana Capital Chronicle looked into this. Nearly 60,000 fewer Hoosiers signed up for health insurance through the Affordable Care Act marketplace this year after enhanced federal tax credits expired. That made monthly premiums more expensive. The Chronicle also found more people covered by employer plans say they can't afford the monthly premiums anymore. So they're considering either high deductible plans or just maybe foregoing coverage altogether. And hospital leaders say they're already seeing the impact. Emergency departments across Indiana reporting a double-digit increase in uninsured patients since the beginning of last year. Advocates say when people don't have insurance, they're more likely to delay routine care and end up getting treated in the ER when health problems become more serious and they just can't wait any longer.
And that just puts a strain on everybody because then you're talking about capacity and services, especially at a time where, in our current economy, things are just more expensive. And that's true of running any business and especially true of running a hospital.
And the issue isn't unique to Indiana. The number of uninsured Americans has been rising nationally as well. You can read the full story online. The Indiana Capital Chronicle's got it.
So the data is also showing that this is heavily impacting middle-class residents.
Yeah, so it focused on that as well. This is from the KFF, the report that they were citing. Found a disproportionate share of Americans who dropped coverage are in middle-income households because they earn too much of what remains of the premium subsidies, so they're kind of in this gap. They make too much to get help.
Yeah.
But not enough to afford insurance.
Yeah.
So the premiums. So they find themselves, like I said, either going with the high deductible plan or foregoing insurance altogether.
And that's pretty much in line with what we're seeing as far as inflation and what some of these national numbers look like, that it's having a huge impact and heavily falling upon middle-class residents.
And having a ripple effect on the rest of the economy as well.